Mr. Even before COVID-19, supports and services for people with disabilities and their carers were woefully inadequate, and the equality that is demanded by the UNCRPD is not and was not a reality. And for the last 6 months, the hardships that all of society has gone through have disproportionately fallen on those with disabilities and carers, with the closure of daycare services, the closure of schools, and so on. And while it is welcome that daycare services are now reopening, they're not going to reopen at full capacity. So there's a hell of a lot more to be done there. But there needs to be a very serious acknowledgement of the carers. You see, the carers are paid €230 for doing a huge state service, which is pretty derisory in the first place, but the double burden that they have had over the last period means, in my opinion, and this is a direct call to you, Minister, and to the Government, there should be a bonus payment given to those carers for the extra service they have given over the last period. An acknowledgement. We rightly praise our healthcare workers for what they've done, but we often forget about the carers and the huge heroic efforts they have made over the recent period. I also think that the acknowledgement by the Government that the PUP payment originally proposed of €203 not being enough for people and that it had to be raised for €350 has implications for our disability payment, for the disability allowance payment. Because if we recognise rightly that €203 is not enough for people who'd lost their employment as a result of the pandemic, then I would say, by the same token, it's not enough for people with disability, particularly when they have additional costs, significant additional costs, like having to get taxis and all sorts of other things. We need to look at increasing that disability payment for carers. I'd also like to mention the Access for All campaign and the campaign they have waged, particularly to pay tribute to Sean O'Kelly and to Bernard Mulvaney for highlighting, the really unacceptable failure to properly maintain the lifts to ensure access to the public transport system. Now, there was a welcome, and I would say it's a victory for the Access for All campaign, that an extra €3.5 million, €3.3 million is to be put into fixing 12 stations in Dublin, and that will be very, very welcome, but that still leaves many DART stations with serious problems, and also that money is not going to see those changes translated until 2024, when you consider that yesterday there were 6 lifts out on the DART line, the day before there was 5, the day before there was 6, and the similar pattern is repeated for the week before that and the week before that. So 2024 is not enough. And we need all of those lifts properly maintained in order to ensure that we get real access and equality of access to public transport for wheelchair users, people with mobility problems and so on. Can I comment briefly on the school transport issue? I have said this to others and I'll say it to you, Minister. There is a win-win if you engage with some of the taxi drivers who are very significantly diminished in the employment opportunities available to them. A number of taxi drivers already provide support, are involved in school transport. There's many others who be crying out for the work, and we've said there's a significant deficit for school transport, and in particular for children with disability and special needs, where there may be concerns about COVID-19 and so on. The taxi drivers, I suggest you engage with the representative organisations to discuss how they could assist the school
transport issue, particularly for those with disabilities, but also how that would also be beneficial for a cohort of workers who are in real trouble and need some additional support. Very finally, I would say I still think, Minister, that you're part of the Ministry for Health, but you're also covering a whole range of other issues. It seems to me that, given our commitments under the UNCRPD, the issue of disability should be taken in under the Department of Taoiseach, which could allow a sort of cross-departmental approach which is needed for disability.
Thank you. Thank you.